Today, the Mississippi State Medical Association now asking for a statewide mask mandate. The group saying it believes the state's healthcare system cannot sustain the current trajectory of the outbreak. There are currently 10 hospitals in the state with 0 ICU beds available. They believe a mask mandate is the best way to help slow the spread and spare our healthcare system from being overwhelmed. Joining us with insight on this issue and more, Singing River Health System's emergency physician, Dr. Greg Patino. Dr. Patino, I know you guys are hard at work over there. Thanks for joining us. Tell me a little bit about, your concerns about the numbers. I mean, I mentioned the 10 hospitals in the state that don't have any ICU beds, and also hospitalizations in general statewide have more than doubled in just 2 weeks to over 1,000. And you're seeing more patients there, of course.
Yes, we've definitely been seeing a lot more patients that are symptomatic. And I believe we had 130 positive cases since last Friday.
And Doctor, what do you think about the Mississippi State Medical Association asking for a statewide mandate? We're seeing more localized mask mandates. There are 13 counties in the state that are now under an executive order for people to wear masks in public. What are your thoughts on a statewide mandate rather than doing it county by county, city by city?
Right. You know, there's obviously a lot of emotional debate about the mask situation, but I think if there's any benefit whatsoever, right, even if you think there's a small benefit, which I think there's probably a much larger benefit to wearing the mask, we have to do whatever we can to kind of keep society going, right, to be allowed us to go to work, to allow people to get out and do the things they need to do. So I think it's a good idea to have the mandate in place.
And tell me a little bit about testing, because I know there are a lot of concerns, more people getting tested. I heard the governor say 15% of the test results are now positive, which is troubling to him. And it's taking longer to get results, too. I know through Singing River, through Memorial. You can go to some faster places, the 24, 48-hour results. What are the benefits to that, and what are perhaps the downfall to going to those faster places? Because both have kind of negatives associated with them.
Right. You know, I think what you're going to find is that testing, not only here but throughout the country, is starting to slow down, and that's just because of the increased volume, right? We're sending all these tests to labs, and they're just overwhelmed. And so you're going to find that there's a slowing of the results coming back to people, not only here, but everywhere. Now, again, and we talked about this when this first started, if you have symptoms, the right thing to do is just to isolate and minimize your exposure to anyone else.
Right, but isn't it a good idea to get tested if you have symptoms too? Otherwise you may have to stay isolated for an even longer period of time if your symptoms don't go away.
That's something that we deal with every day, is trying to make that decision. Right now, luckily, we do have access to enough tests to try to do as many as possible on an outpatient basis and for those people that are coming in. But I tell you, the numbers and availability of those tests are going down across the country. And so we may be at a point, in the next couple of weeks where we have to kind of ration those tests. But we are certainly, for those who are sickest, we are using those as much as possible to see where we have to place them in the hospital. And we're trying to do as many outpatient as we can, as long as our supply allows us to do that.
All right. Well, that's frightening that there might not be enough tests in the future, and also that some of the results are taking so long right now, because that causes some complications. All right. Thank you, Dr. Patino, for joining us today. Appreciate your insight.